unable to keep up with homeostasis for the balance of substances in the body.
I'll be talking about signs and symptoms. So I'll start off with general signs and symptoms of CBD. So the first one is angina. Angina is basically when the mother has chest pain or discomfort. And the next one is pain, which usually the mother will get pain in the neck, jaw, the throat, the upper abdomen, and the back. Fatigue, which is just basically tiredness. Shortness of breath, heart palpitations, and extreme cyanosis. Cyanosis is basically when your fingers, toes, and lips appear blue. And pregnant women who have diabetes will usually get cyanosis because they don't maintain their sugar levels, as well as pregnant women who use certain over-the-counter drugs and street meds. The next one is rapid or shallow breathing, high blood pressure, swollen parts of the body, which usually are your neck, veins, feet, and ankles, abnormalities in the retina, abnormal heart sounds, fluid in the lungs, aortic aneurysm, which is abnormal bulge which occurs in the weak spot in the aorta. It can be found in two forms. One is fusiform, which is tube-shaped, or saccular, which is round. And if I'll just scroll to the bottom. Next is reduced fetal pulse, absent pulse, lightheadedness, and pale, clammy appearance. The next signs and symptoms I'll be talking about is gestational hypertension. You will usually get headaches, tiredness, nosebleeds, blurred vision, and vomiting. Heart failure signs and symptoms are dyspnea, which is shortness of breath or trouble breathing, fatigue and weakness, edema, which usually occurs in the feet, ankles, and legs, rapid irregular heartbeat, reduced ability to exercise, persistent coughing or wheezing, need to urinate, sites, which is basically when fluid builds up in the abdomen, weight gain due to fluid retention, and fluid retention is buildup of fluid in the circulatory system, tissues, and cavities of the body, and water is found both inside and outside of the body cells. Lack of appetite and nausea, and decreased concentration and alertness, and shortness of breath. And this diagram right here displays the aortic aneurysm, which is right here. And aortic aneurysm can lead to aortic dissection, which is basically when the inner layer of the aorta tears, letting the blood enter through, and then it will make the layers separate.
Okay, so now I'll be talking about treatment. You can take medication, and then there are also surgeries that can help with CBD. Most of the medication can still be taken while pregnant. 1/3 of women with CBD take medication during pregnancy. If you don't take medication, that can cause harm to the fetus. Medications recommended by your doctor may include beta blockers, diuretics, calcium channel blockers, heparin injections, or some other type of medication. Norepinephrine is one that you probably shouldn't be taking just because it can harm the fetus more severely, causing birth defects and things like that, especially in the first trimester. One of the surgeries that you can have is called the valvoplasty, which can be done in the first trimester to avoid radiation because the fetus will be smaller at that point. And then there are some risks associated with that, including blood clots, bleeding at insertion site, infection, abnormal heart rhythm, kidney failure, stroke, worsened valve leakage, a rupture of the valve. And death can also occur if there are problems with it. So basically, they insert a catheter and then they go up into the heart and put it through a valve, and then they will pump up the balloon and deflate it for sure once, up to several times. And for the procedure, jewelry will need to be removed and obviously a gown being put on, seeing as you're at the hospital for this procedure. And then, yeah, there's the steps there. The doctor will prep you and you'll probably stay one night at the hospital. When you are getting treatments, you will want an emergency delivery plan in place if you're pregnant, because obviously there could be complications where you would have to remove the baby for the safety of the baby and the mother. So usually a vaginal delivery is preferred because it is more natural, but cesarean is also an option, and that is recommended for more severe conditions. Yeah, and having this plan is usually recommended if you have a severe condition of cardiovascular disease.
Okay, so being pregnant with a heart condition, there's some risks. Some of those might include a heart murmur, arrhythmias, high blood pressure, or mitral valve prolapses. If you have something like Marfan syndrome, artificial valves, or a history of a heart failure or a heart attack, you are at a higher risk of having heart disease when you're pregnant. So one thing is to have an early detection early in the problem. At a doctor's visit, you should have them look for infection, cardiac decomposition, pulmonary congestion, or cardiac arrhythmias. Some recommendations to prevent cardiovascular disease are avoiding excess gain weight or edema. Even though you're pregnant, having too much excess gain weight can put too much stress on your heart and cause cardiovascular disease. Eating a low sodium diet or resting in a left lateral position instead of supine, because resting in a supine position decreases the blood flow to the fetus, which is not healthy. You can also avoid strenuous activity and trying to avoid or prevent anemia. You should receive early treatment, and postmenopausal hormone therapy is not suggested to being used. You should refer to a cardiologist or a gynecologist, which is a doctor that works specifically with women, or an obstetrician, which they'll look at your heart and your heart rhythms to make sure it's healthy. And they'll consider treatment because of the stress to your heart with cardiovascular disease and being pregnant. So some steps are to keep your appointments, take medication as it's prescribed, get lots of rest, monitor your weight gain, know what's off limits like drugs, alcohol, caffeine, and to manage your extra weight. If you are at risk for endocytosis, you should receive antibiotics before and after your pregnancy. So you can eat a DASH-like diet, which concludes of 4 servings of fruits and vegetables per day, 3 servings of whole grains, 2 servings of fish, and 4 more servings of nuts, seeds, and other sources of protein in your diet. To engage in a little bit of physical activity, manage weight, and first of all, not smoking. Taking aspirin can lower your risk of myocardial infarction risk in women because it decreases the risk of your blood clotting, and that decreases your risk of cardiovascular disease. Alcohol also does that. If you're not pregnant and you're specifically a woman, having 1 moderate drink a day decreases the risk of your blood clotting, which decreases your risk of cardiovascular disease. But of course, heavy drinking causes high blood pressure, which is the #1 risk for cardiovascular disease.
Leading cause of death in men and women, but however, women surpass men on this. Women are at a higher risk for hypertension,
42 million women in the world are all living with CVD, and CVD kills 1 in 3 women each year, which calculates down to 1 woman dying every 80 seconds. 17.7 million people die each year from CVD, and that's an estimated 31% deaths of the world worldwide. 2.4 million Canadians are living with ischemic heart disease, which is the second leading cause of death in Canada. Gestational hypertension statistics, this only affects about 6 to 8% of all pregnant women, and about a quarter of those will eventually develop preeclampsia. Gestational hypertension usually resolves itself about a couple weeks after delivery of the baby, and it can reoccur in women who have had it before. And for heart failure, there are nearly 5 million Americans living with heart failure. This affects men and women of all ages, but however, it's present in 2% of people aged 40 to 59, and more than 5% of people aged 60 to 69 have heart failure. This is the most common diagnosis in the hospital for patients over the age of 65 years old, and more than half diagnosed with heart failure will die within 5 years of diagnosis. Deaths of heart failure have decreased on average 12% per decade for women over the past 50 years, so it is decreasing a bit. And it's about 287,000 deaths per year on heart failure.
So now we'll be focusing on 3 main systems that we chose, and I'll be talking about the circulatory system, and there's posters by those girls over there that will be pointing. I will mostly be focusing on the bolded terms. So I'll start with blood volume. Blood volume reduces the chance of blood loss. Fetal changes with respiratory gases, oxygen, carbon dioxide, oxide, nutrients and metabolites occur in the placenta. Heart size and position. Enlarging uterus can cause the heart to shift to the left and closer to the head, as well as the size of your heart while you're pregnant increases by 12%. Cardiac output, which cardiac output occurs during your first trimester, is 30 to 40% higher than when you're not pregnant, and it goes from 6.7 liters per minute to 8.7 liters per minute. Blood pressure. If blood pressure increases past regular levels during your second and third trimester, you should contact your doctor. As well as high blood pressure creates women that are pregnant, they are at a higher risk for CVD. The second system we chose to focus on was the expiratory system, and the main function of the heart is to pump the oxygenated blood all around the body and help keep you alive. The heart basically works as a delivery system to carry blood, oxygen, and nutrients all around the body. And the main kidney functions is to clean the blood of waste, help with blood pressure control, help make red blood cells, and keep balance of substances in the blood. And the heart and kidneys work together because the heart pumps blood through the kidneys, and the kidneys cleans it. And then if the heart and kidneys don't work together, then that increases your risk for CVD or kidney disease. And just a change during pregnancy is that the higher blood volume cardiac output increases, causes the renal blood flow to increase. Alright, our third system we chose to focus on was the endocrine system. I will be talking about human chorionic gonadotropin, or HGC. HGC increases the blood flow in the pelvic area and kidneys, allowing the waste to exit quicker. Estrogen rises steadily during pregnancy, and it helps with the development of fetal organs like the lungs, the liver, and the kidneys. Progesterone increases blood vessel growth in the womb, which increases the womb size. And HPL, or human placental lactogen, increases the growth of the fetal and maternal tissues, and can increase blood pressure levels and increase lipid levels. Alright, so now we'll be doing the Group2. guys want to open that up on your phones, if you have devices, you can go to kahoot.it. Once you guys are all on the site, you can enter this pin
Ooh, we know this one. That's not fair. They should be. I got 4th place.
Oh, okay. Well, not everyone got one.
Okay, so I just want to thank you guys all for coming, and a special thank you to Dr. Gakatan, Ms. Trees, and Mr. Weeb, and hope you guys have a good time. Do you guys have any questions?